Cancer will soon overtake heart disease as the leading cause of death in the U.S. A new study shows that the number of new cancer cases will increase by 45% in the next 2 decades. Jennifer Lukey shows us how local doctors are preparing to handle the influx of patients.
Most of us have been impacted ourselves by cancer or know someone who has.
Imagine an 18-year-old far from home calling at 5 o'clock in the morning, and she said, Mommy, I have ovarian cancer.
I had a breast sonogram, and then that's when they found that I had stage 0 cancer.
Never think that it can't happen to you. Like, it can.
The number of new cancer cases is expected to almost double in the next 16 years.
This is a problem that has been recognized as brewing up over the last few years. ASCO, the Society of Clinical Oncology, has been putting out the numbers for some time that there are more people with cancer and fewer people to care for them.
Dr. Schlossberg of New York Oncology Hematology says they've been prepping for the influx of patients for a few years now, expanding services and recently hiring 5 new physicians to work alongside senior doctors. What's key, he says, is bringing resources as close to the patients as possible.
We partner with our local hospitals, our local colleagues and other specialties when needed for advanced things we cannot offer here, but most people can get almost the entirety of their treatment right down the street.
Close to home so they can go about their lives as normal as possible. And while a cancer diagnosis is a very scary thing, many cancers are now treatable, and a lot of groundbreaking research is actually being done locally.
Over the last few years, patients participating in our research programs have led to the approvals of over 24 new cancer drugs. So people right here in our local area have access to things coming right out of the lab and other drugs that look promising, and we're trying to figure out, are they good?
In the meantime, all of us need to do what we can to try and stay healthy.
There's no magic vitamin that will prevent things from ever happening, but if you live a healthy life and remain as healthy as possible, you'll lower your chances.
Now, the most common types of cancer are lung, breast cancer, and skin cancer. And while the number of people with colon cancer is still high, it's actually been decreasing over recent years. Doctors say if you get a cancer diagnosis and you want to do research, start with cancer.gov and make sure anywhere you go from there is a legitimate medical site. Live in studio tonight, Jennifer Lukey, CBS 6 News.